For the latest on where talks stand in the Senate, I'm joined now by Democratic Senator Chris Coons of Delaware. Senator, thank you so much for being with us. I saw, senators on the Senate floor today chit-chatting with each other. It looked like there were some informal talks going on. Were you privy to any of those conversations?
Yes, John, I talked to a number of colleagues today. As your viewers would expect, I am working to try and find a path forward. But let's be clear. The reason we're having this government shutdown is because Democrats are standing up for health care for Americans and their families, and Republicans are refusing to change direction. Decisions they've made, votes they've cast, are making Americans sicker and poorer. President Trump ran for president saying he would lower Americans' costs and make America healthy again. But today, he imposed tariffs on imported drugs and pharmaceuticals that will double costs for those taking these life-saving drugs. Because of the so-called big, beautiful bill, loss of Medicaid coverage is going to throw millions of Americans off of health care. And starting this month, the loss of the Obamacare subsidies is going to raise health insurance rates for millions by double digits. What does all this mean? Democrats are working to find a way forward where we will make changes that restore health care and cut costs for millions of American families. As your fact checker just made clear, John, President Trump and Vice President Vance are lying about Democrats fighting to give health care to illegal aliens. For years, it has been against the law for someone who's undocumented in the United States to benefit from, to be enrolled in Medicare, Medicaid, or the Affordable Care Act exchanges. That's not what this is about. This is about fighting for health care that's affordable for Americans.
So almost all Democrats voted along with you the last couple of days, but there were three holdouts, including your Democratic colleague, Senator Catherine Cortez Masto from Nevada. I want you to listen to what she said, why she voted for this Republican spending plan.
I don't see actually engaging in a shutdown that's going to harm people to help people. Our goal should be to help everyone.
So why do you think she's wrong?
Look, John, I respect my colleague, Catherine Cortez Masto, and I understand that she's concerned about the impact on federal workers, on law enforcement, on armed forces of going without pay. But the health care cuts that President Trump and the Republicans who control Congress are imposing on the American people will impact everyone and for a long time. They will increase emergency room wait times. They will increase health care insurance costs. They've already cut billions of dollars out of research into everything from Alzheimer's to childhood cancer. We need to make a stand to reverse these harmful cuts, and I think now is the time to do that.
Any conversations with Republicans on the Senate floor? Are they yielding any fruit? Do you feel like you're making any headway?
Yes, I talked with a dozen Republican colleagues, folks who serve with me on the Appropriations Committee, folks I've known from the 15 years I've served there. And there is agreement that we should be willing to negotiate an extension of the Affordable Care Act subsidies and a reform to them. Republicans want to reform them. Democrats want to extend them. And they're insisting, as of now, that we all vote to reopen the government, and then we'll start negotiating. I'm encouraging them to be serious and concrete about who will negotiate, how, over what, and with what deadline. I'm also urging them to put on the Senate floor the health care spending bill that has already passed the Appropriations Committee by a big bipartisan margin, 26-3, that would reject Trump's devastating cuts to the National Institutes of Health and to the Centers for Disease Control. Passing that bill that would restore tens of billions of dollars of threatened cuts to these key healthcare agencies would be, I think, a great sign of progress towards changing course away from these disastrous healthcare cuts.
Well, we'll see if either side budges. Senator Chris Coons from Delaware, thanks for being with us tonight.